Cytomel may be one of the most effective thyroid medications on the market. And because your thyroid plays a role in regulating your metabolism, it also happens to be the best at managing weight. Does this mean that every thyroid patient should run out and start taking it? No, not exactly. But it definitely means that it can and should be considered, especially if you are somebody who is not able to lose weight despite doing everything else right. Before you run out and start taking it, here's what you need to know. Looking at the available research on physiology, we can say that your thyroid is responsible for about 50 to 60% of your basal metabolic rate. This is the rate at which you burn calories at rest, and people who have a higher basal metabolic rate have an easier time losing weight. Because Cytomel contains the most powerful thyroid hormone, as T3, it's considered far stronger than other more standard thyroid medications like levothyroxine, which only contain T4. So if you take Cytomel instead of levothyroxine, then you are providing a much more significant boost to your thyroid and therefore your metabolism. The end result is more weight loss. But on top of this, thyroid patients who use Cytomel will also see a reduction in the amount of water weight that's on their body. And this is another common cause of weight gain among thyroid patients that's often missed. When you combine the increase in metabolism with the increase in water loss, most thyroid patients who take Cytomel will see a drop in their weight as measured on the scale. Understanding how this works is actually pretty simple. Understanding how to use it safely is a little more complex. Because Cytomel is much stronger than T4-only thyroid medications like levothyroxine, there are a few extra steps that you should take if you plan on using it. As someone with a thyroid problem, you're probably well familiar with the need to evaluate your thyroid using thyroid lab tests. This recommendation still applies if you're taking Cytomel, but there are a few extra tests that you need to get. These lab tests include free T3, total T3, and reverse T3. These three lab tests need to be added to the standard lab test that most thyroid patients get in the form of TSH and free T4. Unfortunately, these are not standard tests that most doctors will order, so you will need to ask for them. But when taking Cytomel, they are important to keep track of because you never want to take more than you need. As I mentioned previously, T3 is far more powerful than T4, so if you're taking more than you need, this may lead to problems such as bone loss and even heart problems. Don't let these symptoms scare you away though, because as long as your dose is normal, they will not occur. On top of these extra thyroid lab tests, you'll also want to keep track of a couple extra metrics as well. One is your resting heart rate, and the other is your basal body temperature. Your resting heart rate should be somewhere between 70 and 80 beats per minute. If you have hypothyroidism, that value may be lower. But if you start taking Cytomel and you see your heart rate increase to the 90s or even the 100s, that's a sign that you're taking too much. Likewise, with your body temperature, this should never exceed 98.6 degrees. If you are measuring your body temperature and you see it increasing above this amount, that's an indication you're probably pushing yourself into a hyperthyroid state. You don't necessarily have to keep track of your basal body temperature or your resting heart rate, but I do find them to be very helpful, especially when you first start taking Cytomel and you're trying to optimize your dose. Once you figure out whether or not you want to take Cytomel, the next thing you need to worry about is your dose. Like any other hormone in the body, taking Cytomel won't do anything unless you're taking enough of it. The balance that you must strike is finding a dose that is high enough so as not to cause unwanted side effects, but not too low so as not to cause any benefit at all, but somewhere in between. For most people, this dose will be somewhere between 5 and 20 micrograms. This dosing recommendation is based solely on the physiologic production of T3 from the thyroid gland, which produces about 10 to 25 micrograms of T3 every single day, assuming the thyroid gland is healthy. And by the way, the healthy thyroid gland also produces about 90 to 100 micrograms of T4, and this will come into play in just a minute. If we start on the basis that we're trying to mimic the production of T3 from the healthy thyroid gland, we will automatically be minimizing the risk of side effects while maximizing the benefits. This is because we already know that the healthy thyroid gland can tolerate this dose. This range of 5 to 20 micrograms is just a guideline because there will always be people who need more or people who need less. For perspective, I've seen people need as small of a dose as 1 to 2 micrograms per day and as high as a dose of 70 micrograms per day. If you do decide to start taking Cytomel, the best way to do this is to start low and go slow. For instance, a typical starting dose may be somewhere around 5 micrograms, and that dose may increase by 5 to 10 micrograms every 10 to 14 days. This slow increase over time allows for the body to adapt to the T3 thyroid hormone, which minimizes your risk of side effects. And in the event that side effects do occur, you can always back down to a dose that worked for you previously. The bottom line is that yes, Cytomel does come with a little bit of extra baggage, but the trade-off is that you are getting the most powerful thyroid hormone available. To illustrate this, let's compare Cytomel to other thyroid medications and their impact on weight loss. Let's start with Thyroid and levothyroxine. As far as weight loss is concerned, Cytomel will be far more powerful and effective than levothyroxine and Thyroid in pretty much every aspect. In terms of magnitude, T3 is approximately 80 to 100 times more powerful than T4, which is the thyroid hormone found in levothyroxine. But instead of thinking about which one is more powerful, I think it's better to think about these two as a complementary pair. While it is true that some people benefit from only taking T3, which by the way, this is referred to as T3 monotherapy, many people do much better when combining T4 with T3. In fact, it's my experience that most thyroid patients will do better if they combine T4, T3, and T2 together. This is what the healthy thyroid gland produces. So by taking all three of these thyroid hormones, you are mimicking that production. And if we look at people who have a healthy thyroid gland, we see that they have a normal weight. From a practical standpoint, this looks like taking more than one thyroid medication. In this case, you'd be taking Cytomel as well as Thyroid or levothyroxine, so you would need 2 prescriptions. This is the case for Thyroid and levothyroxine, but how does Cytomel compare to NDT? This comparison is a little different because unlike levothyroxine, NDT formulations like Armour Thyroid and NP Thyroid already come with a combination of T4 and T3 built into them. When we look at NDT, we see that each grain, which is just a unit of measurement, contains 38 micrograms of T4 and 9 micrograms of T3. This ratio puts us pretty close to the 80-20 production that the healthy thyroid gland produces. So if you were to use my recommendations and use a combination of Cytomel plus levothyroxine or Thyroid, you would be pretty close to that ratio. For this reason, the answer regarding which is better has more to do with personal preference and tolerance than anything else. It's been my personal experience that some people just do better when taking Armour Thyroid and others just do better when taking Cytomel. And sometimes it's hard to figure out who is who without some element of trial and error. If you spend time on social media, you will no doubt come into contact with people who evangelize one over the other. But don't fall for the hype. One is not inherently better than the other, even if they throw around terms like natural or synthetic. The reality is that both can work and both can help you lose weight, provided they are used correctly. This leads us to the next topic, which is side effects. If you are planning on taking Cytomel, then you must be aware of its potential to cause side effects. These side effects do tend to be dose dependent, which means if you're taking too much, you might experience negative side effects. If you're taking too little, you'll experience no side effects. But if you're taking just the right amount, then you should really only experience positive side effects. The higher the dose that you take, the more likely you are to experience weight loss, but also the more likely you are to experience the negative side effects. Some of these negative side effects include things like hair loss, heart palpitations, an increase in heart rate and an increase in body temperature, which by the way is why we track those two things, weight loss or even weight gain if you're taking too much, a jittery sensation or increased anxiety, headaches, and even loose stools. Let me be clear in saying that these are the negative side effects, and just because you're taking Cytomel doesn't guarantee that you will experience them. If you are taking the exact amount that your body needs and following the recommendations that I've just gone through here, your risk of experiencing these will be very minimized. If you do this, instead, you should experience the positive side effects of Cytomel, and these include things like the weight loss that you're looking for, a natural increase in energy, a decrease in hair loss and an increase in hair growth, an improvement in cognition, a decrease in brain fog, and an improvement in sleep. Again, whether or not you experience these side effects has everything to do with the dose or the amount that you are taking. So no matter what, make sure you spend time to optimize your dose before you decide whether or not it's working for you. I've seen many thyroid patients prematurely stop taking a medication that would have worked for them had they spent some time trying to figure out its dose. Cytomel is definitely one of my own personal favorite thyroid medications and one that I often recommend to thyroid patients, predominantly because of its power. But this power does come with some added responsibility, so don't take that lightly. If you can nail down your dose and you don't mind some of these extra lab tests that are required, it can be an easy way to help you effortlessly lose weight that you have gained from the hypothyroid state. By the way, if you are a thyroid patient who is struggling to lose weight, then I'd recommend checking out this video next. It walks you through how to use T2 thyroid hormone, which, much like T3, is more powerful than levothyroxine at boosting metabolism and helping with weight loss. The only problem is most thyroid patients have no idea it even exists. So check out this video if you want to learn more.